Hi, this is Jean Bridge, and my topic is opioid use disorder and the implementation of Naloxone Protocol. The problem, according to CDC's 2020 report, approximately 100,000 Americans died from opioid drug overdoses. Naloxone is an opioid antagonist that has been proven to quickly reverse an opioid overdose. Although protocols were implemented in America for healthcare workers and naloxone administration, the protocols aren't effective due to a lack of proper education about opioid use disorder and how to properly administer, dispense, and prescribe the medication, leading to poor patient health outcomes. There is also a lack of protocols for everyday Americans to administer intranasal naloxone in the case their friends or relatives have an overdose. Inadequate nationwide awareness of the availability of the medication of naloxone. Practice change. Developing a nationwide educational program ahead about opioid use disorder for healthcare workers, including pharmacists, and implementing a national healthcare approved protocol to dispense, administer, and prescribe naloxone. The protocol will include instructional courses on how to administer naloxone. Naloxone can be administered subcutaneously, intranasally, intramuscularly, and intravenously. Everyday American citizens will be taught how to administer intranasally, while healthcare workers will learn all four methods of administration, prospectively turning the protocol into individual state or federal legislation. Evidence. In the state of Ohio, state laws are in place that gives American citizens access to naloxone at their local pharmacies without needing a prescription from a medical provider. Minnesota pharmacists were attempting to utilize state legislation to dispense naloxone. Unfortunately, they were distributing the medication inappropriately. Researchers were able to attribute this issue to the pharmacist's lack of confidence in dispensing naloxone. In order to counteract this issue, local healthcare workers provided education and support to pharmacists concerning the medication. A literature review conducted by the Faculty of Medicine at the University of British Columbia and British Columbia Center for Disease Control concluded at home naloxone kit programs significantly reduced the adverse effects of opioid use disorder and improved patient health outcomes. Researchers also concluded healthcare workers fully supported the idea of implementing nationwide naloxone protocols. Researchers further emphasized the importance of access to naloxone through a study conducted that showcased the need for naloxone in correctional facilities. Recommendations from evidence-based research, possibly recommending state legislation for implementing naloxone protocol and educational courses for the public to discuss access and availability to naloxone, create collaborative learning modules between healthcare workers and pharmacists to ensure appropriate dispensing of naloxone to reduce opioid use. Further research should be conducted to assess how cost-effective take-home naloxone kits are. Increasing access to naloxone nationally, including correctional facilities. Implications for practice. Current and future healthcare providers may be required to complete naloxone protocol training prior to receiving their degrees or starting their residency. Possible continuing medical education courses may be required to renew medical licenses. Patients with opioid use disorder, along with their friends and family, may be given the option via medical providers to complete an naloxone learning course modules. Pharmacists and healthcare workers may develop collaborative programs to encourage quality patient care concerning naloxone education, administration, distribution. Possible passing of federal legislation and federal funding given nationwide to implement naloxone protocols. Ultimately, significant reduction in patient health outcomes with opioid use disorder. Thanks for listening to me, and I hope everyone have a good and safe weekend.